What if the swelling in your legs isn't just fluid? What if it's your body warning you that something deeper is happening? What if it's your body's silent warning, pointing to your heart, kidneys, or circulation? Many people over 60 dismiss it as normal aging, but it's not. Edema isn't random, it's a signal you shouldn't ignore. Why do many older adults in China experience less swelling and better circulation, even into old age? Today, we explore the lifestyle habits behind it and why modern health experts are starting to pay closer attention. Later in this video, I'll reveal exactly what that method is and how to use it safely. But first, you need to understand what edema really is and why your body is warning you. The real question is, can you recognize it and take action before it's too late? Today, we decode that signal completely, from the cutting edge of medical science to the Chinese ancient healing Chinese. In Chinese tradition, swelling is seen as blocked flow. Movement restores balance. Modern medicine and traditional Chinese wisdom agree on one thing: flow must never stop. Stay with us until the very end, because the insights you gain here could fundamentally transform how you care for your body forever. What is edema? Let's unlock the science. Edema is essentially fluid trapped within your body's tissues. Medically speaking, it's a delicate balance gone awry. When your capillaries, those microscopic blood vessels, begin leaking fluid into surrounding tissue faster than your body can drain it away. Clinical explanations from respected institutions like the Mayo Clinic confirm this isn't random. It's a direct consequence of 1. Pressure imbalances within blood vessels. 2. Underlying inflammation. Compromised circulation. 3. Or a faltering in critical organ systems responsible for fluid regulation. But here's the crucial distinction most people miss. Edema itself is not the disease. It is a profound symptom. So the real question isn't just what it is, but why your body is losing its fundamental control over fluid balance. Why it happens. The reasons fluid accumulates fall into 2 distinct categories. First, the everyday reversible causes like 1. Prolonged sitting or standing, staying in one position for too long. 2. Excessive salt intake. 3. Exposure to extreme heat. 4. Pregnancy. Sometimes pregnancy can trigger fluid retention and swelling. 5. Certain medications like blood pressure drugs or anti-inflammatories can cause edema. These are common and often easily managed. And second, underlying medical conditions. Danger signs. There's the second, more serious category. If swelling comes with chest pain or shortness of breath, seek immediate help. Hidden medical causes. Some dangerous hidden medical causes include 1. Heart failure. This is where the alarm bells ring. This is where it becomes dangerous. In heart failure, fluid can back up into your legs, and in more severe cases, even your lungs. 2. Kidney disease prevents proper fluid filtration. 3. Liver disease disrupts essential fluid balance. 4. Venous insufficiency, leading to blood pooling in your legs. 5. Or even blood clots like deep vein thrombosis. Extensive clinical research confirms that edema is frequently an early warning sign of significant organ stress, not merely a consequence of aging. So the urgent question becomes, is your swelling a temporary inconvenience or a systemic cry for help? Symptoms. Edema isn't random. It's your body sending a warning sign. Look for 1. Swelling in your feet, ankles, or hands. 2. Shoes or rings feeling suddenly tight. 3. Skin appearing shiny and stretched. 4. A persistent dent left when pressed. what's known as pitting edema. 5. A feeling of heaviness or stiffness in your legs. 6. And unexplained sudden weight gain due to fluid retention. But here's the profound insight often overlooked. If this swelling begins to spread across multiple areas of your body, it is often signaling a deeper, widespread internal imbalance. So ask yourself honestly, is this getting worse over time? Acute symptoms. Now we enter critical territory. Sometimes swelling is more than a warning, it's an emergency. But before we proceed, consider subscribing to support the channel and help it grow. Seek immediate medical attention if your swelling is accompanied by any of these acute symptoms. 1. Sudden shortness of breath. 2. Sharp chest pain. 3. Abrupt swelling in only one leg, especially with pain or warmth. 4. An irregular or racing heartbeat. 5. These are not minor. They could indicate pulmonary edema, meaning fluid accumulation in your lungs. 6. Or deep vein thrombosis, DVT, a dangerous blood clot. Both can become life-threatening if ignored. Your body is giving you a critical message here. Consult a doctor immediately. Do not delay. So the question isn't just if you'd recognize the danger, but when you would act. Who is at risk? You are at an elevated risk if you 1. Are over 65 years of age. 2. Have pre-existing heart, kidney, or liver conditions. 3. Are taking multiple medications known to cause fluid retention, suffer from poor circulation. 4. Or follow a low-protein or high-salt diet. But here's the surprising revelation. Even inactivity alone can contribute to chronic fluid retention over time. Because healthy circulation isn't a passive process. It absolutely must be actively stimulated and supported. If left unaddressed, edema can tragically progress into a cascade of debilitating issues like 1. Chronic, persistent pain, significant difficulty walking and moving. 2. Recurrent skin infections, severely reduced mobility and independence. 3. Irreversible tissue damage, painful skin ulcers. In severe ignored cases, it may tragically contribute to life-threatening complications involving vital organs. So the real question is not simply, is this swelling an annoying inconvenience? What is it truly progressing into, and if I don't act? Do you remember the traditional Chinese remedy for edema I mentioned earlier? Don't worry, we'll get to it soon. Modern medical solutions, what doctors do first. Modern medicine operates on a singular foundational principle. Treat the underlying cause, not merely the symptom of swelling. Doctors typically employ a range of diagnostic and therapeutic approaches. 1. Prescribing diuretics to help your body eliminate excess fluid. 2. Recommending compression therapy such as specialized stockings. 3. Adjusting existing medications that may be contributing to the issue. 4. Utilizing advanced blood tests and imaging techniques to pinpoint causes. 5. And most critically, treating the underlying disease directly. One commonly prescribed medication specifically aids your body in removing fluid through urine, thereby reducing pressure in your tissues. But here's the most fundamental truth, acknowledged by medical science itself. Medicine works to treat the system. But your daily lifestyle choices, they ultimately control the triggers. Natural methods that support recovery. Medical experts consistently endorse these foundational yet incredibly powerful habits. 1. Consistent movement. Your muscles act like natural pumps, powerfully pushing fluid upward against gravity. 2. Leg elevation. A simple, effective method that uses gravity to naturally drain fluid away from your lower extremities. 3. Compression socks. These provide crucial external support, aiding circulation and significantly reducing fluid pooling. 4. Lower salt intake. A direct way to reduce overall fluid retention in your body. 5. Optimal hydration. Ironically, dehydration can paradoxically worsen swelling. Research shows these methods are highly effective for mild to moderate edema. Proper water intake is vital. But there is another system in the world that has practiced this for centuries: the Chinese Tai Chi circulation system. I've read claims that some older adults in parts of China may have lower rates of edema. Are there lifestyle or environmental factors yet to be discovered? Extensive research unequivocally demonstrates that these methods are highly effective for managing mild to moderate edema. But there exists another profound system of knowledge, one that has perfected the art of fluid balance for centuries. It is an ancient Chinese remedy that may hold the answer, and we're about to explore it. If you're finding this helpful, write yes in the comment, subscribe, and hit the notifications. Now, as promised, we explore the power of traditional Chinese medicine. In the profound wisdom of traditional Chinese medicine, TCM, edema is not just a simple fluid buildup. It is understood as a fundamental flow problem. The human body is viewed as an intricate system of interconnected currents. The subtle movement of energy or qi ensures the continuous flow of blood and the essential movement of fluids. When this vital flow slows down or becomes obstructed, fluid inevitably stagnates. And what's truly remarkable is how this ancient concept surprisingly aligns with cutting-edge modern vascular science. Because impaired lymphatic drainage and reduced overall circulation are scientifically proven significant contributors to swelling. The transformative effect of Tai Chi. These slow, deliberate movement practices like Tai Chi 1 actively stimulate and enhance circulation. 2. Tai Chi's gentle rhythmic movements may help stimulate circulation and support lymphatic flow and profoundly reduce fluid retention. 4. And significantly enhance overall mobility, especially in older adults. Even the gentlest, most subtle movement becomes a powerful form of therapy. So what might appear slow or understated is in fact precision healing, eloquently set in motion. Herbs, heat, and balance, Eastern support system. Traditional Chinese approaches extend far beyond movement, encompassing a holistic strategy. Herbs, heat, and balance, the Eastern support system most people overlook. But now, let's shift to what they actually drink. They drink carefully selected herbal teas known to support natural fluid balance. Look for Number 1. Dandelion tea contains caffeic acid derivatives. Known for its gentle diuretic effect, it helps the body eliminate excess fluid. 2. Hawthorn tea contains flavonoids, like quercetin and rutin, is traditionally used to support circulation and heart health, which can influence fluid balance. 3. Ginger tea, rich in gingerols, the main bioactive compounds known for anti-inflammatory and circulation-supporting effects, support circulation and digestion, which can reduce fluid retention. 4. Barley tea, often called mugicha in Japan and Korea, is a caffeine-free drink made by steeping roasted barley in hot water. Common in Chinese medicine, it helps promote urination and ease swelling. Then comes a practice rooted in simplicity and circulation. Warm foot baths, a simple yet powerful technique to increase circulation in the extremities. Gentle acupressure techniques applied to specific points can improve blood circulation. They focus on consuming warm, nourishing foods rather than cold or cooling foods that may disrupt balance. Modern research, intriguingly, provides support for many of these principles. Heat is known to improve peripheral blood flow. Certain plant compounds have been identified for their mild diuretic effects. And various forms of massage can indeed enhance lymphatic drainage. The core idea is beautifully simple yet profoundly effective. Support the natural flow, reduce stagnation, alleviate swelling. Global agreement, different languages, different philosophies, different methods. Yet when it comes to treating edema, both Western medical system and Chinese wisdom converge on 4 undeniable truths, or rather, pillars. Consistent movement is crucial to reducing swelling. Vibrant circulation is absolutely essential for health. Your daily diet profoundly impacts fluid balance, and any form of stagnation inevitably worsens edema. Different explanations, yet the same profound conclusion. The human body, above all else, must keep moving. Here is a powerful, globally integrated routine you can adopt. Engage in light walking or gentle stretching. Prioritize immediate hydration. Gently activate your leg muscles. Actively avoid prolonged sitting or standing. Move and stretch every hour, even for just a few minutes. Consciously reduce your salt intake. Elevate your legs above heart level for 15 to 20 minutes. Enjoy a warm foot soak to relax and stimulate circulation. Perform gentle upward massage on your legs. This simple framework seamlessly blends modern medical guidance, proven natural therapies, and the profound Eastern philosophy of continuous circulation. Don't feel overwhelmed. Choose just one of these actions to start with today. Even a single consistent step can begin to transform your body's fluid balance. Edema is far more than just visible swelling. It's simple to understand. It is a profound form of communication from your inner self. 1. It tells you the true state of your circulation. 2. The current functioning of your vital organs. 3. The precise impact of your lifestyle choices on your entire body. And the most hopeful, most empowering truth is this. In countless cases, edema is entirely reversible, but only if you listen and respond early. Because your body, in its profound wisdom, never screams first, it whispers. Start with one single meaningful action today. If this video has offered you clarity, insight, or even just a glimmer of hope, please do not ignore its message. Start with one single meaningful action today. Move more. Consciously reduce your salt intake. Elevate your legs, or crucially, speak to a doctor if your symptoms persist or worsen. And if you desire more science-backed, truly practical health insights specifically designed for staying strong and thriving after 60, subscribe to 60 Plus Active Life. Share, like, and hit the notification bell. Because aging is an inevitable journey, but decline, we believe, is a choice. Share this video with someone you care about who might need to hear this message. And always remember this fundamental truth. Your body doesn't fail suddenly. It signals first. Start listening and acting today. Thanks for watching.